Okay, more Mainers are dying from overdoses. There's no way around it. Looking at the latest data from January to November of last year, Maine reported 578 confirmed or suspected drug overdoses. That is a 23% jump from all of 2020 and more than 50% higher than 2019. And that's why state lawmakers in Augusta are proposing a bill that looks to prevent overdoses as well as life-threatening infections among those battling addiction. They're looking at a pretty controversial practice, needle exchanges. News Center Range John Stackhouse explains.
As Maine's opioid crisis rages on,
2021 was the deadliest year in Maine's opioid epidemic.
lawmakers are looking to act.
This crisis requires a sharper focus on prevention, harm reduction, and treatment.
That's Representative Genevieve McDonald. She's sponsoring a bill currently that aims to remove restrictions from needle exchange programs, making it easier for those battling addiction to get clean syringes.
That will help keep more people alive until they can get the help they need and that they deserve.
Right now, under Maine law, licensed Maine Syringe Service Programs, or SPPs, are only able to distribute one needle for every needle that's returned. This bill would eliminate that, allowing for clean needles to be given to anyone that asks.
People should have the health care that they need, and this is one way to get it to them.
On Monday night, Representative McDonald and recovery advocates hosted an information session on the proposed bill. Infectious disease and addiction medicine specialist Dr. Keena Thakarar says a law like this helps keep those struggling safer and can prevent diseases like HIV, hepatitis, and endocarditis caused by dirty needles.
If people use a new needle or new equipment every time they inject, they have a much less chance of getting infected. And at this point, I've seen countless people in the hospital who have said they've had to reuse their equipment because they haven't been able to access a new needle or syringe every time.
At the onset of the pandemic, Governor Mills issued an emergency order that eliminated the one-for-one needle exchange requirement. That order has since expired, though, and many that work with those in the throes of addiction say it allowed for greater communication with drug users.
No other service related to substance use meets an individual where they are truly at and non-coercively works with them to sustain or improve their health.
In an effort to keep those with substance use disorder healthier immediately and building relationships to be there when they're ready to enter recovery. Sean Stackhouse, News Center, Maine.
Now, this bill is written as an emergency, so if it passes, it would take effect right away. But it is bound to face some opposition. A public hearing for both sides to weigh in is set for February 1st.